Hello, welcome back to FearlessBeyond. We are starting a series of episodes centered around ailments which have significant stigma around them. The first few episodes will be focused on brain cancer, and I'll be sharing my journey with brain cancer with all of you. So, my name is Pulkit, and I was diagnosed with brain cancer a few months back, and I'm sharing what are the symptoms I got and the test and the scans were done that led to this diagnosis. So one morning I had got up from the bed and I was trying to go out of the room, but I observed that there was some abnormal kicking in the left leg, and which can be described as a jerky movement. And the left side of the body was significantly heavier, as if I had slept on that side. Um, so there was no headache, which made me think that why am I getting something of this sort? And gradually my walk started to become wobbly. So somebody said that I was unable to bend the knee while walking, so which is why the walk was looking a bit wobbly and funny. The thing that I personally observed after getting up from the bed was I was unable to wear slippers and slides because there was very less finger control of the foot, so I was not able to wear the slipper. So what I did was somehow just pushed my foot into the slide and dragged it to the end of the wall and pushed my full foot into it. After this, I noticed that my foot had started feeling significantly heavier. There was a stiffness around the ankle, and as if I was walking with wearing a 2 kg weight around the ankle area. So what somebody was observing was that I was walking without bending the knee, but indeed I was just dragging my foot because it was feeling so heavy. And I also tried going up and down a flight of stairs, and that also became a challenge because the spatial orientation of the leg had started becoming an issue, meaning when I stepped my foot forward, it was unclear where it will land. It was, as if in a normal individual, if if you're taking your foot forward, where it will land. For me, that was not happening, and somebody said that it seems that you're thinking too much while climbing the stairs or while walking down the stairs. So I had to take a neurologist consultation for this, and the neurologist examined my foot physically, and he said that in medical terms it is called a foot drop. So there was power in the foot, but the full control of the foot was not in my hands. So he called that it's a foot drop, and some tests would be done to diagnose what is the cause of it, because it was not normal. So I was referred to a radiologist to get a brain MRI done to identify a cause for it. So let me show you how did the brain scan looked, and what was there in the report, and how did the neurologist and the doctors interpreted it. So as you can see, this is how the brain scan looked, and if you carefully observe, there is this very dark, either very bright or very dark black hole in the brain. So the brain scan is flipped. So what you're seeing on the left side of the body is actually the right side of the brain, and that is how a MRI comes. So if you see that on the left side of the brain, which is an image of the right side of my brain, there is a hole, and that is different from the rest of the image of the brain tissue, because that is a signal that the MRI is able to capture from abnormal tissue, versus if you look at the rest of the image, that is very normal how a brain MRI looks. So the report mentioned that it is a right parietal sol. Sol stands for space occupying lesion. Lesion is an abnormal mass. One can say that. So it was very close to the motor and sensory cortex, which are responsible for the sensation of touch, movement of the body. And because this was in the right side of the brain, so the left side of the body was impacted, because in brain the right side of the brain controls the left side of the body, and vice versa. So it also mentioned that it is some sort of tumor. They mentioned glioma in the report, but histopathological correlation was needed to come to a final diagnosis. Now, what is histopathological correlation is? It's in layman terms, it can be termed as a biopsy, meaning some test would be done on the brain tissue to actually confirm what kind of abnormal tissue is it. So the case was referred to a neurosurgeon for tumor debulking surgery, meaning a brain surgery which will actually remove this tumor, and then the tumor will be processed for histopathology. Now, there was significant risk in getting this brain surgery done, because the motor region of the brain was involved. So there is always a risk of damaging that functional area of the brain. And apart from this, there are other significant risks with brain surgery, like bleeding, CSF leak. So all those risks were also there, and I was made aware of all of that. But that is how the case went ahead. It was referred to a neurosurgery department. And so I consulted a few neurosurgeons in some good cities of India, and the advice was common from all of them that waiting for this thing and not going for surgery, because there is significant risk of paralysis, will not be an option, because eventually I was getting these symptoms, and eventually they will grow worse and have the possibility of making me bedridden very soon. So I was advised to consult other neurosurgeons, and wherever I find it comfortable, I should go ahead with the surgery over there. So the general advice was an image-guided craniotomy. Craniotomy is a surgery of the cranium, meaning the brain skull, and image-guided because it is through these MRI and CT scan images the surgeon is actually able to navigate through the brain, making as least damage to the normal brain tissue and approaching the abnormal brain tissue to get it out. So the summary from the neurosurgery consultations was that yes, it is definitely a right parietal tumor, and I was advised to take second opinions from other neurosurgeons and finalize a neurosurgeon and good hospital facility where I would like to get the surgery done. And along with this, there were other advanced MRI sequences which were recommended before the surgery, which included a perfusion MRI. I'll come to all of this and explain it to you that why were these done and what was the outcome of all this. So apart from perfusion MRI, there was a functional MRI, fMRI, and a tractography, which is specifically done to delineate the tracts of the brain, the nerve cells of the brain, the nerve pathways, or in layman terms you can say the electrical wiring of the brain, which was connecting the brain to the motor neurons of the left part of the body. And so let us come to how do these scans look and what was the interpretation of these scans. So this is how a perfusion MRI look, and so there are these red and yellow spots in the brain scan, which are indicating that there is blood flow in that area. So red is an increased blood flow, and the yellow spots are for low blood flow. So the idea is that higher is the brain perfusion around the tumor area, meaning higher is the blood flow in that area, meaning higher is the um, supply of blood in that area, higher will be the biological activity in terms of the normal tissue and the abnormal tissue, indicating a more aggressive tumor growth. So in my case, if you see that around the around the tumor area there are not much yellow spots, they are away from it, which means at the time the scan was taken, the blood activity was not very high, but it was significant enough to make the tumor grow at the size at which it is appearing. So you can compare it with the size of the normal brain, and how much is that cavity which is looking on the scan. So this is how the tractography looked, and you can see that these colored tracts are there, and they actually represent the electrical wiring of the brain, the motor tracts, which are the cells of the brain which are connecting the brain with the nerve cells of the left part of the body, are responsible for motor and um, sensory movements of the left part of the body. So this is how it looks, and it was really important to get this scan done in my case. And I don't think so this kind of scan is available at all MRI facilities. I might be wrong, but I got this scan done in Delhi, in Gurgaon specifically, to see how are these looking. And I think any neurosurgeon in a good facility will recommend a scan like this if some eloquent area of the brain is involved. So this is the scan which was used during the surgery to avoid the motor tracts and reach the tumor. So I'll explain in the next video how the surgery was done and what are the things one must keep in mind before going for such a surgery. If you have any questions, please do leave them in the comments below. And if you find this video informative, do give it a thumbs up, subscribe to Fearless Beyond, and I'll see you next time.